Today's May 1st meeting of the Senate Finance Committee will come to order. We have one bill on the agenda today, Senate File 4699, Senator Wiklund, the Health and Human Services Supplemental Appropriations Bill. Welcome to the committee.
Thank you, Mr. Chair. Yes, I'm happy to bring the Health and Human Services Supplemental Budget Omnibus Bill to the committee today. Senate File 4699 represents a great deal of work in the Health and Human Services Committee. We diligently examined issues and heard many bills. This final product represents provisions from over 70 bills that we heard in our committee. We tried to make the best use of the limited target that we had, and I think that the final result represents a very broad cross-section of ideas and provisions that will have a positive impact on many Minnesotans' lives. Some of the key areas, our bill represents two different targets, the Health and Human Services target and the Children and Families target. So within the Health and Human Services area, I'm proud of the investments that we have put into mental health. We've put in the foundations for rate increases. We've also added additional grants, and we've looked to the future of our mental health Medicaid reimbursements to include provisions that will help us develop additional services that can be covered through medical assistance, and the Department of Human Services will do that work to put together what is needed so we can implement those rates and cover more mental health services. That is a limitation of our current system. There aren't billing capabilities for many services. We've also, the bill takes steps to, enhance equity in our healthcare system. We have coverage, insurance coverage mandates for different items, such as improving coverage for prosthetics and orthotics. Coverage, we have a bill provision included from Senator Dietzick that would provide greater coverage for wigs for cancer patients. We also have an innovative provision that will help us begin to cover in our public programs some of the game-changing gene therapies and therapies for rare diseases. I think people have heard about new innovations and treatments for diseases like sickle cell disease, which affects a lot of people, and this would be life-changing for people who have that disease. But we need to have a new reimbursement process for some of these medications. They are extremely expensive, and the Department of Human Services has worked with the bill author, and we've come up with a proposal that would provide a method for covering these types of treatments. And then in our Children and Families target, that includes provisions that will address food insecurity. We have the governor's proposal for a new summer EBT program, and we also include provisions for statewide food bank support and some money for food shelves as well. There's also a provision for SNAP access for college students that was brought to us by Senator Putnam. In the Children and Families area, we also have a significant investment in IT. One of the things we heard from many different perspectives that our current system for that deals with our child welfare. Many different entities use the system, SSIS, and all of them report that it is just, it is so bogged down and slow that it is just really difficult for caseworkers to use. It's very time consuming, and it's a real barrier for improving our child protection system, along with other programs that utilize this system. So we have a significant investment to move to a new IT system. We also have provisions that address childcare, some limited funding for childcare facility improvements, and some funding for training for childcare workers. We know that childcare workers still, the compensation level is very low, and we believe that investing in training and also in their infrastructure is an important way to try to assist, because we know that we need more people to want to go into the childcare field. I guess switching back to the healthcare, I didn't mention in terms of healthcare workforce and provider infrastructure. We have a provision that will help us draw down additional funding from the federal government to cover graduate medical education costs. This will be a help for our hospitals who do provide training for medical providers, but they are not currently reimbursed at a high enough rate. And so this will help us draw additional federal money in to cover those costs. We included some recommendations from the University of Minnesota Academic Health Center Task Force. One is to have the Department of Health study or provide us information on developing a healthcare workforce council to help us with workforce planning. One thing we know is that we don't have enough healthcare workers, but we don't have a way currently to bring together the information that we collect about shortage areas and where we need providers, and then make recommendations about how can we better get more people in the pipeline in the right professions, the right times. So that is in there, as well as in RFI for studying kind of our overall health system infrastructure, and finding ways for the University of Minnesota's key role in our academic health system to be a collaborator with systems around the state. We have a provision in here to also address reducing physician burnout. And we also have several provisions that relate to pharmacies. We heard that community pharmacies are not able to make it on their current reimbursement rates, and we have several provisions that will pay a higher dispensing fee for pharmacies, and also will allow pharmacists to perform additional services like prescribing HIV medications, and also continue to provide vaccinations as they currently can due to some pandemic regulations that are going to expire. So there's also a section on emergency medical services, and we have also significant portions of the bill that are governor policy bills that were brought forward to us. So I think I will stop there. There is a bill index, and that will help you locate different topics in the bill. And there's also a bill summary, which is quite extensive and detailed, so that will help you as well if you don't want to delve into the 600 pages of the bill. And I will now stop, and maybe we can have Mr. Albrecht go through the spreadsheet.
Thank you, Senator Wiklund. Did you want to go to your amendments first or before, after he goes through the spreadsheet?
Would it be better to do that? It doesn't matter. I think it would be better just to go through the spreadsheet, and then we can do the amendments.
Mr. Albrecht, welcome to the committee, and please go ahead.
Good morning, Mr. Chair and members. The Health and Human Services spreadsheet, as you know, is a little bit different than a lot of them that come to you, so I'll just take a minute to orient you to it. You should have a timestamp on the bottom of 1:11 p.m. on April 30th, I hope. On line 12, first of all, in the center of the sheet are the governor's proposals, and then the columns on the right-hand side are the Senate proposals. Lines 12 to 19 track the appropriations by fund. Particular interest, of course, is the general fund on line 12. And for 24-25, the amount is $46.37 million. And for 26-27, the amount in the general fund is $36.58 million. Those amounts reflect the revised targets from the adjustment that was announced yesterday. Lines 24 to 32 track the Healthcare Access Fund balance. Line 26 is the beginning balance, and then lines 27 to 30 track the changes in appropriations for the various agencies in this bill. And importantly for this committee, the leadership agreement did include a target for the Healthcare Access Fund of 0. So the opening balance for fiscal year 2027 was $142.004 million, and the ending balance is the same amount. So that's your indication that that target was met. The next sections just summarize the appropriations by agency and by fund within each of those agencies that are in the bill, and those extend to the bottom of page 1 and on to page 2. The change items begin on page 2 in the middle for the Department of Human Services. Generally, as I go through this, if there is a governor's proposal that the Senate has not picked up, there are all zeros in the Senate columns, and I tend to skip over those. But if any of them interest you, I'd be happy to talk about them. The first proposal is on line 136. Senator Wiklund mentioned this one. It is a governor's proposal for SSIS modernization, and the Senate funds that at a different amount, $11.2 million one time, compared to the governor's request of $15 million. On line 142 is a governor's proposal for the summer EBT program, and that's fully funded in the Senate with $10.2 million in the first biennium and $10.3 in the second. On line 150 is a governor's proposal that was modified in the Senate that relates to the Minnesota Care Public Option implementation. The Senate's proposal reallocates unexpended amounts that were appropriated last year in fiscal year 24 and moves them to fiscal year 25, and then expands the uses of that remaining, or I should say unexpended amount, to include the activities that the governor's budget proposal includes over 3 different state agencies. On the next page at the top, on line 154, this also relates to the Minnesota Care Public Option implementation. You'll see that there is a note on line 155 that talks about the fiscal effect beginning in fiscal year 2028 and thereafter. That obviously is not reflected on this spreadsheet because it doesn't include fiscal year 2028. The lines 157 to 162 are the Senate's proposals to allocate a contingent appropriation that was included in the budget bill last year of $22 million, and the Senate's proposal is to use that $22 million for a variety of activities to move forward with implementing the Minnesota Care Public Option. And you can see there that part of the activities, the first three lines are first activities at the Department of Human Services. Then line 160 is an amount that would be transferred to the Department of Commerce for their work on the Minnesota Care Public Option. And then on line 161 is the amount that would be transferred to MinSure for their work on that proposal. Line 164 is a governor's proposal relating to food security. It's additional funding. The Senate largely matches the governor's proposal, just differently. So the Senate picks up two of the governor's lines here for a total of $2 million of one-time funding in the first biennium. Line 170 is a governor's proposal relating to implementing federal health care requirements for DACA recipients. That has the effect of reducing spending for Minnesota Care because the federal government would be paying for part of the cost of their coverage. On line 184 is a governor's proposal for a weighted risk system for licensed child care providers. The amount for that is $228,000 in the first biennium and $244,000 in the second. On line 189 is the governor's proposal for DHS-related costs to transition to the new Department of Children, Youth, and Families. The total for that in the first biennium is $824,000, and it's $3.3 million in the second biennium. On line 194, we're now on page 4, is a provision to repeal a contingent appropriation from last year's HHS budget bill. It's for the direct care and treatment area of the Department of Human Services, and results in reduced spending of $6.1 million this biennium and $15.1 million in the next. Line 198 is a series of corrections and adjustments to the DHS budget. Some of them were errors in tracking in last year's budget bill. Some of them were addressing the placement of riders and the budget activities to which some appropriations were incorrectly coded. The end result of all of it is no change in the dollars. It's largely just moving money around within the DHS budget. On line 211 is Senate File 716. This is the African American Family Preservation Act. The appropriations for that are $7.5 million in the first biennium and $6.8 million in the second. On line 224 is Senate File 1639. This is a grant relating to prevention of non-relative foster care placements, and it's one-time funding of $550,000. On line 228 is Senate File 1176. Senator Wiklund mentioned this in her comments. It relates to pharmacists administering vaccines, and the cost for that is $141,000 in the first year and $250,000 in the second biennium. On the next page, page 5, on line 234, is Senate File 1620. This is a grant, a one-time grant to Uable Emotional Health, and the total for that proposal is $307,000. On line 240 is Senate File 2320. This is the proposal relating to pharmacists administering HIV drugs and also modifications to step therapy requirements for HIV drugs. Has a one-time cost in the first year of $136,000 and about $3 million ongoing in the second biennium. On line 249 is Senate File 2916. This is a grant to Ramsey County for the Youth Mental Health Urgency Room, and it's one-time funding of $1.5 million. On line 253 is Senate File 3351. This is a coverage requirement for prosthetic devices. And this reflects the MA and Minnesota Care cost for that proposal, which is $1.05 million in the first year and $5.4 million in the second biennium. Line 261 is Senate File 3372. This is the County Administered Rural Medical Assistance proposal with one-time funding of $272,000 in the first biennium. Line 266 on the next page, on page 6, is Senate File 3614. This is a proposal to develop a reporting tool relating to SSI and RSDI income. It's $136,000 in the first biennium with ongoing costs of $34,000 per year. On line 271 is Senate File 3820. This is a study of the child maltreatment reporting system with one-time funding of $136,000. On line 276 is Senate File 4058. This is one of the proposals Senator Wiklund mentioned. It's developing a payment methodology for biological products in inpatient settings for rare diseases. And it's a little over $1 million in the first year with ongoing costs of $2.6 million each year in the second biennium. On line 280 is Senate File 4185. This is one-time funding for the Minnesota Food Bank program. This is one of the governor's proposals that the Senate does just a little bit differently relating to food banks. And it's one-time funding of $4 million. The next one is on line 284. It's Senate File 4341. This is a grant to coordinate professional development for child care providers, associate credentials. It's one-time funding of $500,000. Line 288 is Senate File 4402. This is SNAP eligibility for college students. SNAP is the Supplemental Nutrition Assistance Program. That's $95,000 in the first biennium and $111,000 per year ongoing. On line 293 is Senate File 4480, the Minnesota modifications to the Minnesota Indian Family Preservation Act. That has a a cost of $10,000 in the first year and then $2,000 per year ongoing. Line 297 at the bottom of this page is Senate File 4761. This is the Child Protection Advisory Council with one-time funding of $317,000. On the next page, we're now on page 7. On line 302 at the top is Senate File 4877. This is the Child Mortality Review Panel modifications. It's $275,000 in the first year and $319,000 per year ongoing. Line 307 is Senate File 4946. Senator Wiklund mentioned this proposal. It's relating to graduate medical education supplemental payments. And this is the administrative cost for that proposal of $95,000 in the first year and $111,000 each year ongoing. This proposal would bring money into the state treasury in addition to this, but it also sends the same amount right back out of the state treasury. Line 312 is Senate File 4986. This is a payment to CLUES for CCBHC services. It's one-time funding of $1.5 million. On line 316 is Senate File 5032. This is the Pregnant and Parenting Homeless Youth Study with one-time funding of $102,000. On line 321 is Senate File 3971, which is a pharmacy dispensing fee increase that has funding of $225,000 in the first year and $1.3 million in the second biennium. Line 328 is Senate File 4170. This is early childhood mental health consultation grants, which is one-time additional funding of $1 million. On line 332 is Senate File 3737, which is child care improvement grants, one-time funding of $500,000. On line 336 is additional funding of $1 million for the emergency services program. On the next page, we're now on page 8. On line 340 is a reduction to the DHS central office funding for administration. It's a total of $4.4 million divided between the two sub-targets that Senator Wiklund mentioned. That's why there's 4 lines there. On line 347 are reductions in fiscal year 2024 appropriation amounts for several behavioral health grants. Each of the grants is listed on lines 349 to 353 and the relative amounts of reduction for each one. On line 355 is the first of several proposals that Senator Wiklund did mention relating to mental health payments and rates. This one, it relates to what we call ERTS and RCS Room and Board for Minnesota Care. That one has $127,000 in the first year and $808,000 in the second biennium. Line 359 is a provision that expands child and family psychoeducation services in MA with a cost of $7,000 in the first year and $37,000 in the second biennium. Line 63 is changes to the assertive community treatment service is $225,000 per year ongoing. Line 367 is an inflation adjustment for adult day treatment services. That's $11,000 in the first year and $86,000 in the second biennium. Line 371 is one proposal from Senate File 4664 that is additional funding for respite services, one-time funding of $3 million. On the next page, we're now on page 9. At the top, on line 375, is additional funding for school-linked behavioral health grants of one-time funding of $3 million. On line 379 is a provision from Senate File 5084. This is known as the rates bill. This one is a mental health provider rate increase for RBRVS. Changing those rates to be 83% of the Medicare rate for mental health services. The cost for that is $1.6 million in the first year and $4.2 million per year ongoing. On line 383 is also from that same bill. This is a provider rate increase for behavioral health homes services at 82% of modeled rates. And that one works out to $598,000 in the first year and $1.6 million per year ongoing. Line 387 is another rate proposal for mental health services. This one is for mental health services paid or provided in hospitals. It's funding of $3.7 million in 2025 and $920,000 in 2026. It is not ongoing at this point. Line 371 is a proposal to develop the parameters for mental health benefits that would be available in the MA program. There are a number of them, and you can see the details on lines 393 to 396, along with some money for administration on line 397. Line 400 is Senate File 3532. This relates to prior authorization requirements, and it has funding in the second biennium of $1.2 million. Line 405 is how Senator Wiklund's bill accomplishes the requirement in the leadership agreement that there be zero change in the healthcare access fund. So on balance, the proposals in this bill would have had a reduction in appropriations in the healthcare access fund, but because the requirement was that it be zero, those savings had to be moved into the general fund. Mr. Chair and members, that is the end of proposals for the Department of Human Services. On the next page, page 10, we move into the Department of Health. The first proposal is on line 414. This is to reduce a proposal for relating to background studies in the state government special revenue fund by $2.88 million per year ongoing. Line 418 is MDH costs related to the pharmacist's authorizations for vaccine administration. That's $381,000 for the first 2 years, and then $176,000 per year after that. On line 422 is Senate File 1303. This is the stillbirth prevention grant, and it's one-time funding of $210,000. On line 426 is Senate File 3531. This is a grant to the Minnesota Medical Association to address healthcare worker well-being. It's one-time funding of $526,000. On line 430 is Senate File 4235. This includes a translation of competency evaluation for the nursing, translation of competency evaluation materials for the nursing assistant registry and regulatory modifications for graduates of foreign nursing schools. This has upfront funding of $471,000 and then $49,000 per year ongoing. Line 434 is Senate File 4807. This is a grant to Chosen Vessels Midwifery Services. It's one-time funding of $263,000. Line 438 is Senate File 4837 relating to HMO regulatory requirements. It's $629,000 in the first year and $404,000 per year ongoing. On line 442 is Senate File 4912. This is a study for the Health Professions Workforce Advisory Council. and it's one-time funding of $150,000. That is one of the proposals Senator Wiklund mentioned relating to the academic health study report. On line 446, we're now on page 11. At the top is an RFI, a request for information on a statewide healthcare needs and capacity and future healthcare needs with one-time funding of $250,000. Line 450 is Senate File 4992, the American Indian Birth Center Planning Grant of $368,000. Line 454 is Senate File 5171, a grant to the Birth Justice Collaborative for African American Focused Home Place Model, one-time funding of $263,000. Line 458 is the repeal of contingent appropriations for the Department of Health that were in Chapter 70. This proposal reduces spending by $1.4 million in the first biennium and $1.1 million in the second. Line 462 is an appropriation reduction for a PULSed study that was in last year's bill that had 2 years worth of funding, but the report was finished in 2024, so this reduces the unexpended portion for fiscal year 2025. Line 466 is Senate File 4074 relating to groundwater thermal exchange devices and permit requirements. This is, excuse me, in the State Government Special Revenue Fund, and it looks like the revenue from that proposal is a little bit greater than the expenditures, which is why it shows a negative amount of $1,000 in the first biennium and $6,000 in the second. Line 471, excuse me, is Senate File 3134. This is regulatory requirements for natural organic reduction, and that has $140,000 in the first biennium and $100,000 in the second. Line 476 at the bottom of that page is Senate File 4101. This relates to the health professionals loan forgiveness program and creation of a new hospital nurse loan forgiveness program. And though the top line of this proposal is 0, it does reduce the amount for the health professionals loan forgiveness program. You can see that on line 478. And then on line 479, it puts the same amount of money towards the hospital nurse loan forgiveness program, which has slightly different requirements to receive benefit in that program. That is the end of proposals for the Department of Health. On the top of page 12 is one of the health licensing boards. The Board of Pharmacy has components of 3 bills here. On line 534 is Senate File 1176. This relates to the pharmacist authority to administer vaccine. Line 535 is Senate File 3460 that relates to plain language on prescription drug labels. And on line 536 is Senate File 3726 that has requirements for reporting changes in ownership or relocation of a pharmacy. And on line 537 is the governor's proposal that the Senate funds at $600,000, which is less than the governor's proposal. That's the only one of those. And this next section are other agencies that are included in the bill. The first one is on line 597. It's additional funding for the Rare Disease Advisory Council, one time of $342,000. The next one for the Senate is on line 605. This is the Department of Education, which has two proposals. On line 607 is the summer EBT program, and on line 608 is additional funding for the Department of Education for the transition to the Department of Children, Youth, and Families. Next is MMB. There are two proposals. One is on line 613. This relates to the insulin safety net program with $300,000 per year ongoing from the Healthcare Access Fund. And then on line 614 is a repeal of a contingent appropriation from last year's bill with a reduction of $232,000 in the general fund. On line 616 is a governor's proposal for the new Department of Children, Youth and Families. This is additional funding in it, and plus acknowledging an amount of FFP for appropriations that were made to that agency last year. On line 622 and on to the next page are changes at the Department of Commerce, of which in the Senate there are three. The first one is on line 626. This is the coverage requirement for prosthetic devices at the Department of Commerce. That reflects the defrail costs for the individual or the private market, I should say. And that is about $1.1 million in the second biennium. Line 627 is Senate File 3967. This is a coverage requirement for abortion services that has defrail costs of $657,000 in the second biennium. And then on line 628 is a proposal that would increase the amount transferred out of the premium security account last year by $8.8 million, which would leave the balance in that account at zero. On line 630 is the governor's proposal for the Family Child Care Ombudsperson. The governor funds that proposal from the general fund, and the Senate is paying for it out of the Child Care and Development Block Grant. That changes on line 634. Then on line 636 is Senate File 4761, the Child Protection Advisory Council, that has one-time funding of $464,000. And on line 640 is, or really 642, our costs at the Attorney General related to Senate File 4837, which was the one about HMO regulatory requirements, and that funding is $73,000 per year ongoing. Mr. Chair, that's the end of the spreadsheet.
Thank you, Mr. Albrecht. Lengthy one. And I wanted to comment real briefly about the fact that you have, and it's indicated on the spreadsheet as well, I appreciate the committees going through, regardless what you ended up concluding with it, with administrative costs, because I saw some of them you indicated, you gave a flat amount, which looked like it was 5% on a lot of them, and some were zero, and so I appreciate the diligence with that, because you guys are trying to figure out what's needed for the various grants, so I appreciate that. Senator Draheim, we have a number of questions from the committee.
Thank you, Chair. Just a couple quick clarifications. A lot of information. Thank you both for your presentations. Can you just give me a brief description what that premium security account cancellation is on 628? What was that account? I'm not on Commerce, so I don't know what that is.
Mr. Chair and Senator Draheim, the premium security account is otherwise known as the reinsurance fund, I suppose. And last year, there was a transfer out of it of $280 some odd million. And then in the February forecast, it showed up with a balance of this amount, $8.8 million or so.
Thank you. We always call it something different. And then, if I could, Chair, can you, Senator Wiklund, the summer EBT program, can you just give me a 10-second explanation what that is? Is that a new program, ongoing program? What?
Mr. Chair, Senator Draham, it's a new program for Minnesota. I don't know if it's a new program totally. It is a way that Minnesota can put in the administrative costs and support that, and then we're able to draw down significant federal funds to go to families for summer food supplement. When kids aren't in school, this is a way for families to have access to an extra EBT amount.
Sure, thank you.
Go ahead.
Senator Wiklund, then, is that a substitution from them going to school and picking up meals at school like we did during COVID?
Correct. This would be, I mean, I don't know if there is any existing program like the ones that had pickups in the summer, but this would be, electronic benefits transfer, so it would be something that families would receive a supplemental amount in the summer, just, as a dollar amount rather than food items to pick up.
Thank you. And then my last, Chair, if I could.
Go ahead.
I really like the deductions on line 340 through, what is that, 353? Can the grant appropriation reductions, can we get a little explanation what those are in those lines there, just a little more detail?
I'm sorry, Mr. Chair, Senator Draham, can you tell me which line are you looking at again?
The whole section from
okay.
the central office administration and then the grant appropriation reductions, just.
I can speak to the, starting on 347, I guess I'll let Mr. Elbeck comment on the central office administration part, but what those represent are funds that we granted in 2023. They were in the 2023 budget, and they had, for 2024, they had not been spent. These amounts had not been spent, and so we are, taking those back and then using them to allocate towards other programs later on, the other mental health programs and grants.
Thank you. I'll hold off on the rest for now. Thank you, Chair.
Thank you. Senator Pratt.
Thank you. Mr. Chair, and just to follow up on Senator Draheim's question, Senator Wiklund, if we're canceling these grants, aren't those grantees, still counting on that money, or have we talked to them and we've determined that those funds are no longer needed?
Mr. Chair, Senator Pratt, these are also funded in 2025. This was money, 2024 money. It does not take away any money from anyone who was expecting the grant money. It's money that hadn't been allocated. There is other funding. I don't have the spreadsheet with me from last year, and we funded these also in 2025 as well, and maybe beyond. I don't know if you.
Mr. Chair and
Go ahead, Mr.
Senator Pratt, they are grants that haven't been awarded yet. So difference, I suppose, between allocated and awarded.
I'm sorry. Yeah.
No RFP had been sent out or so nobody had been promised the money.
Okay. Thank you.
Further questions? If not, Senator Wiklund, did you want to have anybody? Go ahead, Senator Westrom, go ahead.
Mr. Chair, Senator Wiklund, you talked about the provisions to start studying how to get more workforce in the assisted living and nursing home area. Can you explain why we're going to study this and what are we going to do to make it better? I mean, we already know there's a problem, and the house is burning down, if you don't know that already. And so why are we studying this and not just putting efforts into getting new people? But can you help me understand this a little better? Because I think studying it's like a first grade effort, and we need to be at senior high levels here and solve the problem.
Mr. Chair, Senator Westrom, I'm sorry if I didn't fully explain that. The study is to provide recommendations on how Minnesota could develop a healthcare workforce advisory council. And it would not be to say we need to study why are there issues, but it's to understand. We collect a lot of information about the healthcare workforce across, all of the healthcare workforce professions. And we have ways of accessing some of that data, but we don't have an entity that helps us by making recommendations about where we could be applying additional funding to increase the workforce, or we could address certain areas of the state. Maybe there's workforce issues in particular areas. So this is meant to be a way that we could better utilize the information that we collect. We certainly understand that there is a significant issue in, nursing home staffing and assisted living, and we also know that we have a lack of, for example, mental health providers in many areas across the state. This would be a body that could help us with addressing where could we more tactically apply grant funding to try and encourage more people to enter the profession, for example. And it's modeled, the language is modeled after the state of Utah has a similar entity, and maybe the name of it could be modified, but it's a way to get to have the Department of Health examine that model and come back with recommendations on how we could implement that in Minnesota.
So, Mr. Chair, Senator Wiklund, has Utah solved, or do they not have a healthcare workforce shortage issue because they've implemented this? And how much money are we going to be spending on this within the agency?
Mr. Chair, Senator Westrom, the allocation that we have in the budget to do this work is $150,000 for the Department of Health to complete the work and develop recommendations on a report. I think that Utah, they have had this workforce council in place only for a few years, but they do have a much more extensive background in collecting and reporting on data having to do with professions. Like I know nursing and physicians, they have had an active, I don't know if council is the right name, but a body that advised on ways to direct their graduate medical education funding to try and encourage more physicians to remain in Utah. They've been very active in kind of studying the distribution of nurses and doctors across the state. They've also done a behavioral health analysis of workforce programs to try and better understand, as they provide funding to these programs, is it having an impact? So no, I don't think they've resolved their issues, but I know that they've identified that it is a big issue and that they need to have a better way to track and identify solutions. And Mr. Chair, they're not the only state. I mean, Indiana has also developed this type of a workforce advisory council. I think that maybe Rhode Island has done some work in this area as well. So it's not that it has to be modeled exactly on Utah's. It's just that they're further along than we are.
Well, Mr. Chair and Senator Wiklund, based on that, I'm not convinced that that's the way we should be spending our money to solve a problem and a crisis we already know exists. More bureaucrats to study something just is wrong-headed. And when we know the problem, it's not like we're on new frontier of some new emerging technology or company. Our nursing homes need less regulations, more just direct reimbursement for work that they do when it's government assistant payments, and to put $150,000 into another workforce advisory council, I just don't think we're going to benefit anything other than add more bureaucracy and fund something that we already know exists, and it's a crisis. And furthermore, if they come back with many more recommendations like we just tried to strip out on the floor yesterday, it's even more concerning, because the solution in Senator Hoffman's bill yesterday was mandate 8 more hours of training before new hirees could even get working in the facility, which is where the problem is. We need to get people working so they can help patients and residents and people that need the care. We don't need to tie them up in more training before they can even get their first hour on the floor, on top of all the other training they get when they start already. And so wherever those recommendations come from, we don't need more bureaucracies to come up with more ideas to mandate more training and requirements before somebody can even get hired. That's not going to solve the problem. And so this whole picture is just going down a dead-end path and going to make the problem worse than better. And so sometimes government isn't the answer, and this is one of those. I just think you could use those dollars somewhere else better, Senator Wiklund.
Thank you. Senator, before we get to your amendment, Senator Wiklund, we have Senator Dames.
Thank you, Mr. Chair. Would you like, I have an amendment that would you like to have?
Rather get through the author's amendments first, so we'll get to those later. Other discussion? If not, Senator Wiklund, you have the A54 is the
Yeah,
technical.
if I could have Senate Counsel come over and
Yes.
walk through the Senate. Yeah, I'd like to offer the A54 amendment.
Okay. Senator Wiklund will offer the A54 amendment, which is in your packets. Mr. Hidalgo, you're going to start?
Yes. Mr. Chair, members of the committee, me and my co-counsel are happy to walk through the A54 amendment. We'll go line by line, just starting at the beginning and proceeding with whichever one of us is familiar with the provisions therein. Line 1.2 of the amendment corrects an erroneous citation to the Code of Federal Regulations. 1.3 is DHSTA regarding a change to the effective date to a provision updating prescription drug dispensing fee amounts. Lines 1.4 to 1.7 updates provisions related to medical debt in order to retain spousal liability in actions relating to estate recovery. Lines 1.8 to 2.10. These lines restructure appropriation language and establish procedural requirements relating to state defrayal of costs for insurance mandates in the individual market. This language aligns with what was historically done in 2019 when the state first passed its initial insurance coverage mandate in 2019. Moving on to page 2, lines 2.11 and 2.12 just make technical changes. Lines 2.13 to 3.7. This has the same reasoning as on the prior page regarding appropriations for state defrayal of insurance mandates. Moving on to line 3.8. This corrects an erroneous internal cross-reference. Lines 3.9 to 4.7. Though they look new, they are purely technical. What they do is combine two sections that were amending the same subdivision, so it just merges the two. That takes us to line 4.18, and 418 and 419 remove Commissioner of Health rulemaking authorization related to natural organic reduction.
Ms. Hoffman-Guici, go ahead.
Mr. Chair, members, on line 13.5, this deletes a section that contains a repealer that was mistakenly included by staff. Lines 13.6 through 13.11 was DHS technical assistance to remove the reference to kin, which is not defined in statute. On page 13, lines 12 through 14, it's just technical assistance from the Department of Human Services to clean up the language. Lines 15 and 16 are purely technical. Lines 17 through 21 modify the Community Resource Center Advisory Council, and these were just suggestions made by the Department of Human Services. Lines 22 to 26 were just DHSTA for a feasible timeline and to correct the Commissioner to the Commissioner of Children, Youth, and Families. Lines 27 to 29 are just changes to correct an error in the language. And on page 14, line 1 through line 12 are just modifications to the Minnesota Indian Family Preservation Act language to better align it with child protection statutes and the current language that's already in law. Page 14, line 13 aligns an effective date, and line 14 is just a staff technical correction. Page 14, line 15 through page 15, line 18 moves language into a different statutory section that's a better fit, and then deletes the current section from the bill. Page 15, lines 19 through 22 is just updated language to reflect discussions with stakeholders. And lines 23 and 24, just a staff conforming change. Lines 15.25 to 16.10, again, is updated language to reflect discussions with stakeholders, and this was just needed in 3 different parts of the bill. Page 16, line 11, is a technical correction. It just deletes a duplicate section. Page 16, lines 12 through 21, is agreed upon language with MMB to clarify accounting for federal reimbursement for administrative costs. Lines 22 and 23 modifies the frequency of the inter and intra-agency report provided by the Department of Human Services from quarterly to annually. Lines 16.24 to 17.24 removes and repeals a currently expired report and then puts an expiration date on the maternal infant health report, so it's not automatically expired in accordance with section 256.01 subdivision 42. And then line 17.25 through the end of the amendment just makes technical and conforming changes so that the appropriations article matches the spreadsheet.
Thank you. Are there questions of the committee on the amendment? If not, Senator Wiklund moves a 54 amendment to the bill. All those in favor say aye.
Aye.
Opposed? Motion prevails. Senator Wiklund, you also have is it 48?
Mr. Chair, yes, there's the A48 amendment. Ms. Hoffman-Litchie can speak to that one.
Okay. Ms. Hoffman-Litchie, go ahead.
Mr. Chair, members, this amendment makes changes to Article 16 of Senate File 4699, which is the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. These changes were made in conformance with DHS and stakeholders and the bill authors and staff. And a majority of the changes are purely technical. They conform the language to current child protection statutes. They make sure it conforms with the Minnesota Indian Family Preservation Act. And then I can walk through a few of the more lengthy technical changes and updates if members would like.
Perhaps not. I guess they're not asking for that. So on the AAFPA amendment, the A48, Senator Wiklund moves that. Is there any discussion? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. Do you have any further amendments, Senator Wiklund, at this time?
There's one that relates to natural organic reduction that I'm not sure if you wanted
Yeah,
to
the
take care of that one right now.
53, yeah, you can. A53 is also in the packets.
Mr. Chair, my understanding is that this is some additional language that needed to be added or modified for the provision that relates to natural organic reduction. And I don't know, Mr. Hadal, if there's more that I should say about that.
And I understand that that's bringing what we call peace in the valley with the funeral directors and so on. Is that the gist of it, I think I heard? Go ahead, Mr. Hadal.
Thank you, Mr. Chair, members of the committee. That is my understanding as well. The one note that I would make, a substantial portion of this amendment differentiates apparently with between when there's a dead body and when it's naturally reduced, and then naturally reduced after that. So it makes a lot of clarifying definitional changes, I believe, to distinguish those two portions. So that's why it's a substantial, it looks like a substantial amendment, but it's a lot of the same concept just being carried throughout the bill. Thank you.
Is there any discussion on the A53 amendment? If not, all those in favor say aye.
Aye.
Opposed? Motion prevails. That's it for your amendments. Other discussion or amendments from the committee? Senator Dames.
Well, thank you, Mr. Chair. And I have the A56 amendment.
Senator Dames offers a 56 amendment. It's not in our packets, so it will be distributed. Thank you. Senator Dames, go ahead.
Well, thank you, Mr. Chair. In the A56 amendment, what this does is it removes the language and the funding for the Minnesota Care Public option. And the reason I put this amendment out is last night we had this bill in Commerce, and we had a very good discussion. And I want to thank Senator Wiklund again for discussion we had last night. But there's just a lot of issues going forward with this that I think need to be resolved before this becomes reality or before it goes much further. First of all, we're going to look at putting this bill into effect in 2028, which leaves a major hole in the process of what we're going to do for insurance after 2025 for the year of 2026 and 2027. Furthermore, there's a lot of unanswered questions that are serious issues that need to be resolved before we move forward with this. A couple of other issues. The rate structure for this will be Medicare, and with the Medicare rate structure, in many cases, depending on the procedures and stuff, the hospitals are going to get paid anywhere from 20 to 40% less than what they do with the current system. And what that's going to do is put a lot of pressure on rural hospitals. And we're having trouble keeping a lot of the services in these rural hospitals. And as these rural hospitals start to shut down, which they would probably have no other choice because of the payment that they would be receiving, it's going to mean further and further for people to drive. And keep in mind, in rural Minnesota, a lot of the folks are elderly and don't have those, they don't have vehicles or don't have the ability to drive anymore. And so that's really going to be an issue there. The other thing to keep in mind is we don't know how far we would get with this with the federal government. There's only two states that I recall that were allowed to continue with a basic health plan, and that was Minnesota and New York. And we were granted that authorization under the Obamacare. And now that we start expanding that, we don't know for sure that would be accepted by the federal government. That's an unknown. Another unknown is the waiver. There's a 1332 waiver. There's two parts of that. And we have been successful in getting that for the reinsurance. We don't know where that would be with this. So there's just a lot of things going on, and I just think this is not the correct time for this. So I would ask people to support this amendment.
Senator Wiklund on the A56.
Thank you, Mr. Chair. Senator James, I would strongly oppose your amendment. Yes, we did have a very good discussion last night in Commerce, and I appreciate that we had the opportunity to talk more about it and talk through the bill and some of the implications of it. My perspective is that the work we've done over the past year, and about a year, work was done much before that, but as of the beginning of last session, through what we passed in 2023 to initiate the very comprehensive study that the actuarial firm did. All of that work was to set us up for a well-thought-out process for moving a program forward to address a segment of the market where people have purchased health insurance, but they can't afford to use their health insurance. They have plans where they pay their premium, and then they have a deductible that is perhaps $7,000 to $10,000 a year. It takes, what we've heard from people and what we heard last night is that they aren't able to access care. And so I strongly oppose removing this from the bill because I believe that we are setting up language in the bill to take us to the next step. And your thoughts about the timeline, the reason that we can't implement it any sooner is because the work to apply for the waiver is a significantly long process of working with the federal government. It's working with them to address the questions that you have raised about whether this will have a negative impact on the market or on providers. They will answer questions about the actuarial soundness of our approach and whether we can continue to receive the federal pass-through funding that we currently receive. All of those questions are things that the research needs to be done and the interaction with the federal government to complete that process. All along during that process, if there are things we learn that make it seem like the program is not feasible in the way that the bill lays out, we could modify that. So it's a process of investigation and application. The rates question, yes, we understand that by moving to Medicare rates, that it does, there would be some impact. I also think that we should consider that our current public programs cover over 1 million people in Minnesota. And if we want to truly address provider needs and hospital needs, we should be looking at proposals like my bill, the rates bill that's been referenced a few times, and how to move us forward to, increasing those rates closer to Medicare rates, if not above them, if that is truly what is needed. That would have a much more significant impact on the market or on the provider income than this proposal, the public option, which would probably have a take-up rate of maybe 60 to 70,000 people in the first years, and those people distributed across the state. That's not to say that there won't be impact if they are receiving lower reimbursement. I'm just saying that in terms of magnitude of impact, we could be looking at addressing that through a means that we control. The basic health plan, yes, that is a consideration. We want to make sure that as we make changes, that we aren't affecting Minnesota Care, because that is something that people count on having in place, and we don't want to impact that. But that's part of the waiver process too, is discussing with the federal government, making sure that they approve of our waiver. So I think that the proposal in my omnibus is something that is sound, that we have taken the steps needed to develop language that should move forward this year so that we can continue work to address this part of the market where we have many people who have come testified last night and in my committee about how they've experienced themselves or seen people experience the lack of opportunity to access care. And it's not because they don't have a provider to go to, it's because they can't afford it. They delay care, and that has very significant impacts on their lives. So again, I would strongly oppose the amendment.
And as Senator Wiklund and I have discussed, I have some real concerns about the cost of this. I think you're right that the folks in the individual market are hurting. Of course, lots of others are as well. And I guess my main concerns are about the very significant costs for this 3% of the public, which is important to do. I mean, I think your bill is filled with things trying to help people deal with this. I think fundamentally, I'm not sure that this moves us forward, though I appreciate that 3% will get much better benefits. It's largely at public expense to do that, and I guess I think that when we're looking at the cost of the negotiations, the cost of reimbursements and so on, we have to fix that on the public programs and so on. But I guess overall, I mean, I don't want to go into great length now, but I think I have real concerns about moving forward on this at this time. So is there further discussion on the amendment? Senator Pratt.
Thank you, Mr. Chair. I'd just like to request a roll call with the results of the roll being printed in the journal.
Senator Pratt requested printed in the journal. There are 3 votes, so it will be. Is there further discussion? If not, staff will take the roll.
Senator Marty?
Chair votes aye.
Senator Friends?
No.
Senator Pratt?
Aye.
Senator Champion?
No.
Senator Dames?
Aye.
Senator Draheim?
Aye.
Senator Eichhorn?
Aye.
Senator Mohammed?
No.
Senator Murphy? Senator Pappas?
No.
Senator Westrom?
Yes.
Senator Wiklund?
No.
Senator apologies, Senator Murphy.
There being 6 ayes and 5 nays, the motion does prevail. Further amendments? Senator Draheim. Senator Draheim offers a 45 amendment, which I don't believe is in the packets. On the amendment, Senator Draheim.
Thank you, Chair. I'm not sure you'll support this one like you did the last one. This is removing provisions that require HMOs that operate in Minnesota to be nonprofits. And I'm sure you're familiar with that bill. And, you know, when I was on Health and Human Service, we did put that provision in to try to create more competition in Minnesota and to give more options for Minnesotans. And when I came in 8 years ago into the Senate, you know, we were really struggling to get an insurance company in every county. And the goal was to have at least 2 options. And we did a lot of changes. The reinsurance was one of the big ones that I know people in this room worked really hard on. And I see no harm in having anybody and everybody, you know, we did the co-op work, bringing in co-ops as an option. To have any entity that wants to try to help people have some form of health insurance, it's totally up to them to decide. So I urge a yes vote on my E45.
Go ahead, Senator Wiklund.
Mr. Chair, Senator Draheim, I would oppose the amendment. I believe that the reason we had this in place is that we were under the belief that these entities, their ultimate motives should not be driven by making a profit for others. And so I would oppose the amendment. And since it's Senator Marty's provision, I'm sure he can speak more directly to it.
Sure. Thank you, Senator Wiklund, Senator Draheim. I, as you did guess, I do oppose the amendment. When Minnesota had for-profits enter the market in the legislation in 2017, there was not a lot of debate about it. It was kind of slipped in, if I recall. And the whole concept, we have had nonprofit insurers in Minnesota in the past, and for-profit insurers have their fiduciary responsibility is to their shareholders. And the only way they can increase the rate of return, the profitability for their shareholders is either by denying care or by collecting more money, neither of which fit our goals of trying to increase access and so on to care. And I think Minnesota we were the only state and would be the only state to remove them. But I think we've had more discussion on this provision this time than we had when it was put in 7, 8 years ago. So I oppose the amendment, but Senator Pratt.
Well, thank you, Mr. Chair, and thank you for bringing this amendment, Senator Draheim. Yeah, I was on the Commerce Committee back when this was first proposed, and I recall quite a bit of discussion around this concept. And that discussion was about making sure that we had the best providers available. Choice is good. And I think there's a fallacy that we believe a nonprofit can do it less expensively. You know, the other thing that a for-profit corporation will do is look for efficiencies. Look for efficiencies in operations where that motive may not be there in a nonprofit. And with the choice, what, you know, as I understand, we currently have 31,000 Minnesotans enrolled through United Healthcare, which is a for-profit entity. Now, DHS made that choice, as I understand, and they made it based on the merits of the plan, not the structure of the company. And that's how we should be making decisions. We should be making decisions based on what they can provide, not how they're organized. And I have a real concern that if this goes in, there's going to be a difficult transition for these 31 people who are relying on this coverage. I've not heard of any complaints, and I think I think we should keep choice at the forefront of our health, and making sure we have as many options in healthcare as possible. So, Mr. Chair, I strongly support the amendment.
Senator Dames.
Well, thank you, Mr. Chair. And we look back several years ago, and when we didn't have much choice in health care, that was a real tough proposition, and it drove prices. Whether you're for profit or nonprofit, you still have to compete in an open marketplace. And you're competing in the open marketplace. If you're outpriced, you're going to lose your customers. So I don't think that by taking the HMOs out that are for profit is going to solve any problems. What it might do is create more problems as to where we get those people insured. And so I think this is a major mistake doing this, and I think that we're going to find that we're going to disrupt the marketplace, as we have a couple times in the past, by putting in plans that we thought were going to work real well, but we didn't think about the unintended consequences. And so I would ask for people to support this amendment, because I think this is a major mistake. They compete in the marketplace, so if they're for profit or not for profit, if they're competing in the marketplace, that's what counts.
Senator Dames and Senator Pratt, in terms of the choice, I think people want a choice of which provider they go to. And Senator Pratt, you called these insurers providers, and I think of providers as the doctors, the clinics, the hospitals, and so on. And the insurers are nothing more than the people who are paying the providers. And to me, the choice, I think people want to be able to choose who their doctor is, not which health insurance plan restricts which doctors they can go see. And in terms of the 31,000 people, we've had transitions where one insurer jumped into the market a few years ago, and then they dropped out of the market in most of the counties a year later, and that was 100,000 plus people, and that was managed fine. The 31,000 people here should not be a difficult thing for them to manage, because this is a lot more time for them to do it. It's not an immediate transition, it's the end of their contracts. So I strongly object to the suggestion that the choice should be of who the insurer is. I think the goal of our healthcare system should be to have people have the choice of who's going to provide their care and what kind of care they're going to get. I think that's where we want to leave a choice. And so I just think that the idea that bringing somebody in whose primary concern is their fiduciary responsibility is to their shareholders. That's pure and simple the way they are structured. And when you see the kind of money they've been making nationally and so on, I don't think that they don't provide any care. They're the ones who pay for the care or deny the care if they don't want to pay for it. And that's my concern about it. So anyhow, I don't want to go longer debate, but Senator Dames, go ahead.
Well, thank you, Mr. Chair. But when we start talking about having selection in the the person, the policyholder can go where they want, to the doctor they want, the hospital they want. Let's back up here and just remember where this all started. And this all started with Obamacare. And the idea was, and we're hearing the same thing today, the idea it was that the government can take this over and that they're going to be able to use your same doctor, you're going to do this, you're going to do that. And they found out very shortly that that did not work. And so Obamacare is the one that started really driving where you're going to go to the doctor and who you're going to use. And so I don't think we should be pointing our finger at the for-profit organizations. My comment to that would be, if you take a look at the nonprofits and take a look at those that are for-profit, the for-profits wouldn't be in business if they didn't have to compete. So if you take a look at the rate structure of the rates that you're paying on a nonprofit policy as for a profit policy, they're competitive. And so I think we're extending our fingers into something we probably shouldn't be. We're concerned about the shareholders, but if the shareholders, if that's the concern, what's the difference as long as they're competitive? And in many cases, they're more competitive. So I think that that's, I don't think that reasoning is very logical here when we look at the overall picture.
Is there further discussion on the Draheim A45 amendment? Senator Pratt.
Thank you, Mr. Chair. And Mr. Chair, I'm not advocating for-profits, and I'm not advocating against nonprofits. The issue is choice, and you're exactly right. Patients should have a choice in who they see. Patients should have a choice in choosing the medical plan that best fits their needs. When they look at the formulary, when they look at the providers that are covered, that's all part of the decision. Now, maybe we've removed the consumer too far from the cost of their health care. I just had this conversation with my daughter the other day. She was amazed that she had to pay a certain amount for a prescription. She's suffering through her allergies right now. Well, you know, it was a rude awakening for her that, yes, this does have a cost, and she has to bear some of that. The fact that Ramsey County and DHS looked at the plans, at the providers, and these 31,000 people chose this plan tells you that choice works, that they made an educated choice. It wasn't foisted upon them, and choice is good. And we should allow Minnesotans to choose who their doctors are. We should allow Minnesotans to choose who their insurers are. And I think this is a good amendment that allows Minnesotans to have that choice, Mr. Chair.
Further discussion on the A45 Draheim amendment. Senator Draheim.
Thank you, Chair, and thank you, members, for the good discussion. And, you know, I think we all can agree the cost of care costs too much. And to me, it should be all hands on deck. And, you know, when we talk about the profits, and I know some of us in this room have had that conversation before about the technical nonprofits in the healthcare spectrum that pay their executive team millions and millions and millions of dollars. And if this is the route we're going to go, then we really need to look at what the definition of a nonprofit really is. The transfer of funds to foundations. I remember one nonprofit that paid their top 16 executives, this is years ago, $32 million. Is that really a nonprofit? Is it really a nonprofit? So the majority here is going to, I can count, they're going to vote down my amendment, and they're going to pick the labeling of an entity over the options of care for Minnesotans. So I know we're running out of time, Chair. We got to get to the floor. So I just urge everybody to support the A45. Thank you.
Thank you. On the A45 Draheim amendment, all those in favor say aye. Aye. Opposed?
No.
Motion does not prevail. Further amendments? Senator Pratt.
Mr. Chair, I don't have a further amendment. I have a question for Senator Wiklund, if I may. Senator Wiklund, in your quite a bit of discussion this session has been around religious exemptions, and I see in some instances you're crossing out religious exemptions for coverage, and then you're adding in a new section. Can you maybe describe what you're trying to do in the religious exemption arena? Because it looks like in some cases it's being removed, but then it's being added back, and I'm just trying to understand.
Mr. Chair, Senator Pratt, we did some reorganizing to make it more straightforward to add as we add different mandates, but Mr. Hidalgo can talk about that.
Thank you.
Is there a further discussion?
I think we're going to get a better explanation.
Oh, I'm sorry, I was not listening to the
No, I
response.
was just thanking Senator Wiklund.
Okay, Mr. Hidalgo.
Thank you, Mr. Chair. Senator Pratt, what Senator Wiklund said is exactly right. It doesn't change anything substantively to the religious objection language. The idea of moving it to its own statutory section is merely to facilitate discussions in future legislatures. If there are going to continue to be religious exemptions added on to these insurance mandates or other ideas, it's much easier to add references within a single section than to keep duplicating a substantial portion of statutory language in multiple places throughout statute.
Senator Pratt.
Thank you. So just to clarify, if let's say I have a cooperative insurance plan through the church, and the church opposes abortion, they would have a religious exemption for that coverage. Is that correct?
Mr. Hidalgo.
Thank you, Mr. Chair. Senator Pratt, it depends on a couple things. One, if a religious objection was decided upon and voted upon, then you could insert that into this new statutory section that was created. They would have to, the church or cooperative that you reference would have to meet the definition of eligible organization that is set forth in that statute. But this change makes it a lot easier to incorporate such religious objections, assuming that they meet, the requirements that are set forth in federal law, which under your hypothetical, I believe they would. But it depends on a number of facts.
Thank you, Mr. Chair. I just wanted to confirm that, after what we saw last year and some of the discussion in the other body, I wanted to make sure that we weren't making any substantial changes, and I just wanted nonpartisan confirmation of that. Thank you.
Thank you. I hope we're wrapping up. If not, we can come back later. Are there any other final comments? Senator Mohammed.
Thank you, Mr. Chair. I just want to thank Senator Wiklund for bringing this bill. I am on the same hallway as her, and I just see how incredibly hard she works in this body and works with so many people. And this bill is thick, and I'm still getting through it. So thank you for doing the work that you do. I appreciate you.
And it is an incredible package. Senator Wiklund, any final comments?
No, Mr. Chair. I mean, I just say I appreciate the discussion today and having the opportunity to present the bill, and look forward to having that opportunity on the floor.
Thank you. Is there further discussion on Senate File 4699? If not, all those in favor say aye.
Aye.
Opposed? No. Motion prevails. Senator Wiklund, Mr. Albrecht, Mr. Hidalgo, Ms. Hoffman-Leachy, thank you all for presenting an incredible bill. With that, this committee, we're not meeting tomorrow. We will be meeting after session on Friday to take up the HHS scope and licensing bill, and also a standalone version of the African American Family Preservation Act, I believe. The Zoom link has been sent out to members if you're not going to be in person that day, so you can participate that way. With that, this meeting is adjourned.